fluoridation, that is, the addition of fluoride to public water systems for the control of tooth decay, has been a public health practice in the United States for 75 years. Public health experts have long known that exposure to excess fluoride can cause molting of the teeth, dental fluorosis, as well as bone and joint abnormalities, skeletal fluorosis. In response, the US EPA established a maximum contaminant level for fluoride of 4.0 parts per million in 1986 as part of the National Primary Drinking Water Regulations. However, emerging research has since suggested links between fluoride exposure and cardiovascular disease such as hypertension, as well as endocrine, neurodevelopmental, and cognitive disorders. What follows is the question that formed the basis of my research. Is the U.S. National Primary Drinking Water Regulations maximum contaminant level for fluoride of 4.0 parts per million, established before the suspected association of hypertension and high drinking water fluoride concentrations, adequate to protect drinking water consumers from fluoride-induced hypertension? Data on the fluoride concentration in U.S. drinking water systems by county were overlaid with data on hypertension in adults by zip code, both data sets being obtained from the U.S. Centers for Disease Control and Prevention. Since the National Primary Drinking Water Regulations set the maximum level of fluoride in drinking water in the U.S. at 4.0 parts per million, data on drinking water fluoride concentrations in excess of 4.0 parts per million and the prevalence of high blood pressure were obtained from published research studies from fluorosis endemic areas of Iran and China. All data was analyzed utilizing IBM's SPSS software, version 27. Data from the U.S. showed no correlation between drinking water fluoride concentration and hypertension. A positive correlation between fluoride and hypertension, that is, an increase in fluoride concentration results in a corresponding increase in the rate of hypertension, would be depicted by a line with a positive slope, such as the red line in Figure 1. A negative correlation, an increase in fluoride concentration results in a decrease in the rate of hypertension, would be depicted by a line with a negative slope, such as the green line in Figure 1. And no association between fluoride concentration and hypertension would be depicted by a horizontal line, such as the blue line in Figure 1. A graphical depiction of the analytical results from the U.S. dataset from this research is shown in black in Figure 1. As you can see, the resulting line is horizontal, corresponding to the no association blue line. Likewise, no correlation was observed between drinking water fluoride concentrations greater than 4.0 parts per million and increased prevalence of hypertension in Iran or China. This research confirms that, even considering additional avenues of fluoride exposure and the possible health risks attributed to excess fluoride, the National Primary Drinking Water Regulations, MCL for fluoride, of 4.0 parts per million protects drinking water consumers from fluoride-induced hypertension.